having a positive influence is part of my value system, and it's a huge motivator for me. Being able to help and support patients with epilepsy and their families, it's good to be working every day in something that means something to you. I'm Mohammed AlQahtani. I'm a last year pediatric neurology resident at the Hospital for Sick Children, or Sick Kids, in Toronto. And as I'm finishing my training here, I'm moving to the US to do an epilepsy fellowship at Boston Children's Hospital. My mentor is Dr. Donner, who is a co-lead of the program, who introduced the program to me when I was in my second year of residency, and she suggested that I do a case. And that was my first, Project ECHO that I attended. And since then, I got hooked, and it was super interesting. The format of presenting the case, the discussions that happened afterwards were very enriching. And I found it very informative and at the same time fun and engaging.
Welcome to what is our 10th and final session of our Neurology Trainee Project ECHO Epilepsy Across the Lifespan.
We want to see you engage. So here's a couple ways that you can earn points towards winning this textbook. So this is like a big deal.
So we like to start with a few introductions. And so if you've turned your camera on, then I'm going to ask you to introduce yourself. Mohammed, would you introduce yourself?
Yeah, of course. I'm Mohammed. I'm a fourth year neurology resident at Sick Kids and the U of T site lead. So for the last year, I think the Neurology Trainee Program was led by my colleague and my senior trainee, Lauren Strasser. She was the resident lead then, and she asked me to be the site lead for University of Toronto. And that's when I joined the team for Neurology Trainee Program. And then the following year, which is this year, basically, she graduated and I took the role of resident lead. And the role of site lead basically was to be the connection between the program and the trainees in that center. So I was lucky to represent my colleagues in the University of Toronto then, and to represent their perspective to Project ECHO and TP, and which was incorporated in the program, the way the program was structured, the way the program was built, the timing, the topics, all of these things. And at the same time, the other way around, where like I got my colleagues to get more engaged and more interested in the program and to join more consistently.
I just want to quickly do a roll call. So normally what we do is we introduce the hub team, and then we reach out to different individuals who are joining us. We have a lot of people joining us, so I may not get a chance to go through everybody. So I might just go through a couple people at the top of the list. So please don't feel left out if I don't reach out to you. It's just that there's 2 pages of people, which is fantastic. We love that.
I had that question of how effective is this project? I know from the feedback I got, I personally felt that the program was very helpful, and I got the feedback from many of my colleagues, and I have a lot of colleagues, as I said, across Canada who are all excited about the program and wanted to continue. But at the same time, that was all subjective, and I had the academic curiosity to know how really effective it is. So it always helps to get an objective measure of the efficacy. So that's the first part of it. And then I also was at the same time doing my master's in health system leadership and innovation. And I was in one of the courses where I was that was focused on medical education basically. And I chatted with my professor there, Dr. Ratnapalan, or Prof. Ratnapalan, and who suggested that I do a study and just look at the efficacy of it. I met with both Dr. Donner and Dr. Ratnapalan, and we both we formulated a study plan. And fast forward 12 months later, we have the study now and we have the results. I did not expect a huge improvement in knowledge in the span of 10 sessions, 10 one-hour sessions that are delivered virtually. I thought that the benefits are there, but they will be marginal. and that the other aspects of making the connections with people across Canada was a great, a good enough reason. But then as we went through the study and we did the quiz, it was basically a randomized controlled trial. And the difference between those who took the course and those who didn't was very significant. There was a more than 25% improvement in knowledge in between them. In medical education terms, that's a huge jump. A 10% improvement is significant. That was very reassuring and very, satisfying to know that it really helps also with the knowledge. I think there are multiple things that are helpful in making the trainees feel like that this is their own program, starting with the name and the fact that it is targeted for them. Then the fact that trainees are involved from the day one of the establishment of the program. In addition to the engagement of the trainees across Canada, we were lucky to have site leads that are very engaged and very active, who were able to motivate their colleagues to participate in the program. We meet together. We have a say in what is going to happen and how it's going to happen and in terms of the topics and all of that. I think that involvement and engagement from the beginning is a huge part of it. And then also the fact that it is very effective and very helpful also is a great reason for trainees to come back again and again to join and to be part, to try to be and to be part of it.